Welcome to another session of Voices in Health. I'm your host, Dr. Barbara Kostick. Our topic today is medicine safety for children. Today's medicines cure infectious diseases, prevent problems from chronic diseases, and alleviate pain for millions of Americans. But medicines can also cause harm when improperly used. Adverse drug events cause over 700,000 emergency department visits each year, and nearly 120,000 of these patients need to be hospitalized for further treatment. Anyone who takes medication has some risk of a harmful effect.
Okay, here you go, sweetie.
But most at risk are children who are less than 5 years old. In fact, they're more than twice as likely as older children to be taken to an emergency department. And most of these visits are the result of lapses of adult supervision.
I'm not really sure, Dr. Wilson. You see, my mom's pill prescription was in her purse and the lid was off. I'm afraid my baby may have swallowed some of the pills. No, it wasn't a child-proof lid. Mom, did you count the pills? Do you know how many should be there?
No, not really. I don't keep track. I only use them when I have problems with my back.
We're not really sure when she swallowed them, or even if she did. No, she's not looking overly drowsy, but it is getting close to her nap time. Doctor, how long would it take for the pills to do some damage?
Mommy?
Just a minute, sweetie. Should I take her to the emergency room? Call who? Poison control? They're not going to be able to do anything over the phone. I mean, if she needs medication and treatment.
Mommy, help me.
I understand that, doctor, but this is my baby. I'm not taking any chances. Okay, yes, I'll let you know. Grab your coat, Mom. We're taking Jenny to the emergency room right away. At least they can examine her there and let us know if she's in any danger.
Okay.
Our first guest is Washington Hospital Emergency Department physician, Dr. Kadeer Halimi. Welcome, Dr. Halimi. What did you think of that scenario we just saw?
Well, I thought that video was very realistic and not much different than what I see every day in the emergency department. And in fact, I've seen similar cases in my own household. My son was found with a pill in his hand that belonged to my mother. She ended up calling me at work. We ended up calling poison control. And end up not going to the emergency department, but it was helpful to have poison control available.
Well, you know, some people feel that poison control might delay treatment. What do you think?
I believe, on the contrary, that poison control can be very helpful. For example, they could identify the pill over the phone. They can tell you things to look for. Say you took a vitamin pill. That may not necessarily mean that you have to go to your primary care doctor or emergency department. However, that vitamin pill, depending on what it is, can cause nausea, can cause vomiting, sometimes cause abdominal pain. So not only do they tell you things to look out for, but when to go to emergency department. Let's say that pill wasn't a vitamin pill, something serious. They'll tell you to call 911, not go in yourself. Or they'll even call us ahead of time saying, we have a patient is coming in, has taken this pill, and here's the things you look out for. So they're very, very helpful resource to have.
So they help you screen on if it's help you determine if it was an overdose and how serious it was.
Absolutely. Once we identify the pill, then it makes it easy for us to intervene the proper way.
When would a parent not call poison control but get their child right to the emergency room? What kind of symptoms would they see?
Well, I mean, if you come home and you find your daughter or son at home passed out or vomiting and they're altered, obviously the first thing to do is call 911. You know your child better than any emergency department room physician, your pediatrician, or anybody on the phone. If you feel your son or daughter has taken something, they're not doing well, and you feel like you need to go into the emergency department, call 911 or go into the emergency department.
And so what happens when a child comes to the emergency department?
So first thing, again, is we try to identify what pill they took. Before that, of course, we get vitals. We make sure that they're stable, make sure they're not, blood pressure not too low, make sure they're maintaining okay. Once we identify the pill, then depending on the pill, we start a treatment plan. whether that's observation, that's fluids, whether that gets to be admission to the hospital. The other thing that I failed to mention earlier was things that have been done in the past have changed. For example, 20 years ago, everybody had cerebral ipecac in their medicine cabinet, which is gone by the wayside. In fact, it's contraindicated. Believe it or not, people still have those medicines in their medicine cabinet from 20 years ago. So it's helpful, again, if you call poison control, and they'll tell you, don't give them this stuff. So don't give them the cerebral ipecac, which actually can do harm rather than good. So depending on what they come in for and what they look like, different treatment plans can be started.
Okay, so if I'm a parent and I come home, what if I suspect that my child has taken something? What would be the signs that I would look for?
Okay, so of course, change of mentation, if they're talking slowly, if they're confused, if they're flushed, if they look red, if you feel like they have a fever, however, they have no symptoms of a cough or a cold or runny nose, if they're vomiting or they have diarrhea, being a good parent, looking around to see if there's open bottles or not, and being very vigilant with your child.
Okay, and let's just talk again. What do you think a parent should do so that they prevent an overdose?
Well, the keys are always preventative in any case scenario. The best thing to do is to have child protective bottles. Have the bottles in a medicine cabinet out of reach of a small child, because usually it's the toddlers and people or kids who don't know what they're taking. So make sure you have it locked away or a place where they can't reach it. Make sure you know what those pill bottles are. Make sure you have poison control on your speed dial, and also I like to have it on the fridge at home so kids know it's available, and and if you're panicking, you know where the number is and you have access to it.
Thank you, Dr. Halimi. When we come back, we'll take a look at what parents should do and what they shouldn't do when they think their child is sick.
Sometimes the littlest people can get into the biggest trouble. That's when you call the Poison Control Center hotline. For poison emergencies or just questions, get expert help day or night. Call 1-800-222-1222.
If you think it might be poison and you don't know what to do, call 1-800-222-1222.
Every woman is unique. At the Washington Women's Center, we take a unique approach to your health. We offer a comfortable, supportive environment, state-of-the-art technology, health screenings and resources, and we're the first center in the Bay Area to be named a nationally accredited breast center. We're more than a health provider. We're your health partner. Call to schedule an appointment.
Mom said no school today. What's wrong? Where does it hurt?
In my stomach, Dad. It's like something's poking me.
Well, Mom might have some medicine here. It'll make you feel all better.
When is it going to work? My stomach still hurts.
Is your stomach upset? Does it feel like you're gonna throw up?
No, Dad. It's like something poking me.
Pretty bad, huh? The directions say take 1 pill every 4 hours. I really hate to see you suffer like this. Tell you what, I'll give you a double dose to start out with. Here you go. Maybe we can kickstart this thing and you can get better even quicker.
Washington Hospital physician Remo Cerruti is a respected and admired Fremont pediatrician. Welcome, Dr. Cerruti. What did you think of that scenario and that father trying to do the right thing?
That was a very, very nice scenario because it demonstrates that all parents want to do the best for their children. And when they're put in a situation where they have to start to worry, is something going wrong, is my child sick, they feel the need that they have to do something, and they do something. But sometimes when parents do that, they aren't either prepared to do it or they don't have the right knowledge to do it. And so they begin to try to treat their children without really doing them a benefit and may indeed harm them in the long run.
Well, how do you educate your parents then?
It's difficult because, first of all, parents always are influenced by many things. One of the things they do is if you watch television, especially during the flu season, the cold seasons, there's marketing to parents that they have to do something about their children's symptoms. There's marketing that they have to give them a specific brand of drug to do something. And then they're made to feel probably guilty if they don't do anything. So one of the things to do is to begin to have parents understand, when is an illness significant, when isn't it? When does it have a natural course that you really shouldn't do anything for? Watch it, observe it. It's what I call comfort and care, and then it runs its course. So it's a very difficult thing to do.
Well, some people feel that comfort and care is the right thing because doesn't it build up the person's natural immunity?
It can, and that's really the difficult part. It's difficult for the physician who is examining the child and the parent. When an illness is in its first stages and children are in distress, they have fever, they're coughing, they don't feel good, their appetite is gone, the natural urge, human urge, is do something. And sometimes if it's so early in the disease course that you don't know what disease it is, because many diseases start off with the same symptom. You don't feel good, you have a fever, you have chills, you ache. And some require significant and specific treatment. Others you have to really just make the child feel better, tie them through the initial phase of the illness, and they do well by themselves.
Well, I have two questions. When should the parent bring the child to see you? And what about antibiotics? Two big questions.
Those are really two big ones. Unfortunately, most of the public at this point feel that antibiotics are some miracle drug and that an antibiotic is indicated for any illness that you ever get. But the reality is antibiotics kill bacteria. Antibiotics don't kill viruses. And the unfortunate thing for us as humans is that probably 90% of our illnesses are caused by viruses. So you begin to have to make the distinction of what do you do just to make somebody feel comfortable while their disease runs their course, and when do you have to intervene with antibiotics? And it's not an easy decision. We have tools, fortunately. We have laboratory work we can do, we have x-rays, we have procedures we can do that sometimes help us distinguish between it. But mostly we have history, we know what time of year it is, we know the age of the child, and so we have an idea of what occurs most predominantly. Cold viruses have a beginning, a middle, and an end. We know that they're going to last 7 to 12 days no matter what you do. So the treatment is basically support. You make somebody feel better. Fever control if the child's in distress, hydration. Those are the things that you do to anyone to make them feel better.
Well, what about this scenario where the father looked at the child, and since the child had abdominal pain, it wasn't cured by one pill, the father said take 2. Do you think children are just little adults and you can change the amount of medicines you give them?
No, I think that's a misconception that most people have, and that really leads to medication error and problems with the safe use of medications. The problem is children aren't half adult or a quarter adult, and doses for medications are really dosed on weight and other factors like liver functions and renal functions that vary from age to age.
So they
it's
really
very
should
dangerous.
Read the directions.
So you should read the directions. We always say, you know, that the medication should be for that specific patient, it should be dosed specifically for that patient, and then it should be given within the times that are specific for that medication and that age group. So it's a much more specific way to give medication. It's dangerous not to.
So back in your office, you see the patient and you've evaluated the patient, and now you're going to give the parent something to take home. What do? Do you give them a roadmap of what to take home?
Well, the first thing you have to give them is you have to give them satisfaction for not having either prescribed an antibiotic or given something powerful drug of something for an illness that doesn't require it. And that's difficult. That takes a long-term education, and it takes also convincing the parent that you know what you're doing, that it is okay to be a little bit uncomfortable. It's okay to wait another day or two. If you're going to be giving antibiotics for infections, then you really should have physical exam criteria that says it, or laboratory criteria that really shows you that it is. One of the misconceptions is that if I see you for a cold today, and if I give you antibiotics today, you won't miss school the rest of the week, you won't get an ear infection, you won't get pneumonia, you won't get complications. And that just simply doesn't work that way.
And what about medication errors then that parents make?
Medication errors can be a real problem because if you don't know what drug you're giving and for what use, you can really harm a patient. That happens all the time. But for me, it begins from the time I write the prescription. I want to make sure that I'm writing for a drug that's indicated.
Okay,
and
so the drug has to be indicated.
Drug has to be indicated. And you know, all drugs are potentially dangerous. There is no such thing as a safe drug. And what we do as pediatricians and as physicians and as pharmacists and all of those that render that kind of care, we look at the risk-benefit ratio. If I'm going to give you something, it better not be worse than the problem you have or cause things that are worse than the problem you have. So you always have to look at risk-benefit ratio. The other thing is the patient should actually look at the name and the drug when they pick it up from the pharmacist, because a lot of errors occur, and I've had that occur for me, where one of my sons goes to the same pharmacy that I get my medications, and he actually received my medication because the pharmacist saw the last name. So even though it's the best pharmacy and the best pharmacist, read the label, make sure you have your medication. The third thing is that they come with safety caps. Make sure that you use the safety cap. It's one thing to have those safety caps on the bottle. It's another thing not to use them or replace them. Another thing is accurate measurements. You should be measuring them with a standard measure, a dropper, a syringe, or a measured teaspoon or a measured dropper that you usually can get at the pharmacist. And most pharmacists will give that to you. The other thing to do is to give a medication for the indicated time.
Oh, right.
We see a lot of patients.
I feel better, I stop the medicine,
right?
they
give it for 2 days, they say, oh, he's better, he's back to school, and what happens is they've really done an incomplete course of therapy. The danger, of course, is that you'll have the recurrent infection. The other danger is that you can also create bacteria that are resistant to antibiotics.
Yeah.
If you're not getting better and you're taking the medication, you should really contact your primary care physician. Just the fact that you're giving medication doesn't mean it's going to work or it's the right medication, even though all the criteria there.
Now, you raised several children, and did you have any problems when you were raising them with medication errors or overdoses or unsupervised?
Yeah, I mentioned the fact that one of my sons got my medications, but another, we actually, in our own family, our last children were twin boys.
Oh my.
And when they were toddlers, they became ill, and we were giving them some medication. And just in the time it took to take the lid off, and both were ill at the same time, obviously, just in the time it took to take the lid off the medication and pour medication for one of the twins, with all the attention focused on that one, the other one grabbed the bottle and chug-a-lugged his twin brother's medication.
Oh, wow.
So it happens anytime, anywhere when you least expect it.
Thank you,
It can
Dr.
happen.
Cerruti.
Yes.
After this short break, we'll discuss selecting and administering over-the-counter and prescription drugs.
We have a better way to treat brain tumors without surgery or anesthesia. There are no knives, no cutting, no nausea or hair loss, and no hospital stay is required. Presenting outpatient gamma knife treatment at the Taylor McAdam Bell Neuroscience Institute in Fremont. Go to gammaknifeprogram.com to learn more.
Nice. No.
Oops.
Yeah, sure.
Let's go.
Moms everywhere are finding ways to keep kids active and healthy.
Works every time.
Get ideas, get involved, get going at letsmove.gov.
Honey? Where's the dosage thingy that comes with the children's liquid aspirin?
It should be with the bottle. Look around. It should be right there somewhere.
We're looking, Mom.
Do you need me to come in there and find it for you?
Nah, we got it handled.
We do?
We sure do, little guy. Look, it says here we should give you 1 teaspoon. And what do we call this?
A teaspoon.
Yep, and if you've seen 1 teaspoon, you've seen them all.
I'm here with pharmacist Minh-Thu Dennen. Dr. Dennen, is a teaspoon always a teaspoon?
No, a teaspoon is not always a teaspoon. Every teaspoon will look different. A teaspoon is 5 ml, and a lot of people confuse a teaspoon for a tablespoon, which is 15 ml, 3 times the size.
If you bake, you'd probably know that difference, right?
True, and if you bake, you would use an actual teaspoon and not the regular teaspoon that you use on a table.
So we'll equate it to baking. That's good.
Yes.
Are there other medication errors that people make?
Yes, there are. One of the most common one is getting the medications for the right size of your child. It's very important if you have an infant to get a medication for an infant versus a child versus an older child. One of the things that people do too is, I used to have an infant and the medication is still good, but now my infant is no longer an infant, but it's a 2-year-old. Can I use the same thing? Can't I just double up on it and be okay? And my answer is no, you really need to get the right medication because of the concentration of the medication for the age of your child.
So the dosing is different. How do we dose children? What do you do to determine a dose?
Because children are small, a lot of times the dosing is in kilogram. That's the other error that people make is, we know our child is in pounds. The child is 10 pounds, 15 pounds, 20 pounds, and you really need to take that pounds divided by 2.2 in order to get the kilogram, because in medicine, we dose everything by kilogram.
So it's important to have the right dose, and then it's important to have the right instrument to deliver the dose?
Absolutely. A lot of the medications, if you notice, it comes with a certain tool. It can come with a syringe, an oral syringe, it can come with a cup, or it can come with a spoon, a measuring spoon. And it's really important for you to keep that when you measure that particular type of medication. Don't mix them. They are much more accurate than a tablespoon that you get out of a drawer at home.
And then what happens when you have the medicine, you've got the tool, where do you keep the medicine?
The most common mistakes people make is either take it out of a original container, which I don't recommend. The manufacturer, when they manufacture a medication, they ensure the stability of the medication based on the container it's stored in. So always keep in an original container, always keep a tight lid, a child-resistant lid on it, away from the children. I want to show you something I brought. These days, medications are very colorful, they're very tasty, and they look like candy. So if you look at these, now if you can pick out, you know that the hearts are Valentine hearts, so those are pretty obvious. But a lot of the times the kids will think the rest of them looks like M&Ms. And they're not. They're actually medication. So it's very important for you to store medications away from kids, because when they open a bottle of colorful candy like that, they will take more than one. These days, they also make medicine in order to try to make it taste better. I've seen medications come as gummy bears. And when you eat gummy bears, you don't eat one, you eat a handful of them.
I think parents also, we make a mistake in trying to just give the kid usually their vitamin and just tell them, sometimes we'll even tell them it's candy.
Right.
Which is probably pretty wrong.
It is. Also the other thing we tell parents is not to leave the medications in the cabinet in the bathroom. The vapor, the heat in there is not very good for the medications. So keep it in the closet, high up, away from the kids. Always keep the tight lid containers on. They're a pain to take off, but they're a pain to take off for you and for the child, and hopefully the child doesn't get into them.
Well, usually when we get medications, from the pharmacist, they have all these little stickers on them, do not drive, keep them in the refrigerator, dark place, etc. But over-the-counter medicines, I guess you have to really read the labels. Is there a particular place on the labels that you read these things?
There's every medication comes with a drug fax.
A drug fax?
A drug fax. It's a piece of paper, and on there it tells you what the active ingredients is, what's indicated for, what are some of the side effects you need to watch out for. Always keep that, because nowadays the drug fax, the very first thing that tells you is active ingredients. When you're dealing with combination drugs, It's very important not to mix medications together, because one medication you can be treating your temperature, your fever, and your cough. Well, you don't want it to be taking another medication for the fever, because now you double up on the dose. It's very confusing. The manufacturers don't standardize the way that they put the information on, even on the drug facts. Sometimes they would recommend dosing it per day versus per dose. So you would be milligrams per kilogram per day, but take it 3 times a day. So you got to take that total dose and divide 3 times. Other ways they can do is milligrams per kilogram per dose. So you take that dose 3 times a day. So it's not very consistent there. The other thing is, sometimes you miss a dose. So you take a dose in the morning, you miss the afternoon dose, so you think, well, I'll just double up at night. And that would get 3 doses in a day. You don't want to do that. If you miss a dose, you just take the normal dose later on that evening. Just 1 dose, do not double up on it.
What about these intervals? When it says 3 times a day, I always wonder what that means. Does that mean I have to do it exactly, 3 into 24 every 8 hours? And if it says 4 times a day, I have to do it exactly every 6 hours, or what?
It depends on the drug. There are certain drugs that you do have to do it, exactly every 6 hours. For those type of drugs, they will tell you, give it every 6 hours, because it's important. For drugs that are 3 times a day, I think you can break it up to about 3 times a day. You definitely don't want to wake up a sleeping baby to give that 3rd dose in the middle of the night. You give it as late as possible and try to split it out. But the other thing you don't want to do is you don't want to give it every 2 hours and try and get all 3 of your doses done in the morning either. So try to break it up as, so
at least 4 hours
3 times a day as much as possible. Yeah. But if the doctor says every 6 hours, do stick to that schedule every 6 hours.
Okay. And what about brand name versus generic?
I get that question all the time.
Really?
Yes, believe it or not. Some people think, well, the brand is so much better because it's a brand name. In order for the generic to be a generic, they have to show bioequivalency to the brand. So if a drug's been out for a while, it's off patent, and there's other companies can make the exact same active ingredients, it has to be shown to be bioequivalent to the brand drug. So it's fine for you to get the generic drug. A lot of times it's a lot less expensive to get the generic drug. If you know some of the drugs that comes out these days, you start out with the brand. Okay, the patent wears off. Usually after 7 years or so, the patent wears off. So the generic companies start making generic drugs. And then what the brand will do is they will combine it with another drug. So now instead of just hitting the fever, now you're going to have another brand that's for the fever and the cough. Now they have another 7 years patent on that particular drug and make a different brand to it. So it's very important for you to look at the active ingredients, see what you're getting, and the generic has to show bioequivalency. So
it's kind of like buying a car. You have to see what kind of accessories come with it, and
that's a good
read that sticker price on there. Is that right?
Exactly.
Oh, thank you, Dr. Dennen. We'll return with all 3 of our guests to talk in more detail about medication safety for your children.
So, do you have any questions?
What is your soup of the day?
We have a mulligatawny soup.
Oh, do you have any specials?
We have a steak special today.
Oh, how's that cooked?
That's pan-seared and then...
Does it come with a side dish? Is it grilled? Can I have it steamed? So, what do you recommend? What kind of pie do you have? You're an actor. Aren't you from Ohio?
Any questions?
Ask questions. For the 10 questions everyone should know, go to ahrq.gov.
You were not created in 2 dimensions. You are a complex construction of muscle and bone, blood vessels and synapses. Seeing your inner workings takes some equally sophisticated technology. That's why at Washington Hospital Outpatient Imaging Center, we've invested in the most advanced digital imaging equipment so we can diagnose you quickly and accurately. We see the whole you to treat the whole you. Go to WHHS.com to learn more.
Sweetie, it looks like you got the sniffles, huh? We certainly don't want this to turn into something worse. You could get the flu or even pneumonia if we're not extra careful.
Will I have to go to the hospital?
No, sweetie. Not if we're extra careful about this cold. Here we go.
Mommy?
Yeah?
Do I have to take all of these?
Well, sweetie, this is for your runny nose, and this is for headaches, because you might get a headache if you end up getting the flu, and a decongestant to help your chest feel better.
But my chest doesn't hurt, just my nose.
Well, it's just your nose now, sweetie. But Mommy wants to make sure we prevent any of those other nasty germs from attacking you. I just want you all well and happy, don't you?
Uh-huh.
That's my girl. Okay, let's take this medicine, get it into your system, and then tuck you into bed. You're gonna need a lot of extra sleep to help this medicine work.
Dr. Cerruti, parents, even overprotective parents, do want to do the right thing for their child. What did you think of that mother in that scenario?
Well, that mom is a very concerned mom. She's very worried. Her little girl has just told her that she's not feeling well. And what interests me is that her immediate response, she feels that she has to do something instantly.
Mm-hmm.
And she not only feels that, but she feels like she has to tie it to future events, like by doing something right now and using a collection of medications, her goal is to take care of the present and any future complications that are coming up. So, and it's a very typical reaction that parents have when their children get sick.
Mm-hmm.
And to add on to that, and oftentimes by combining medication, you're actually giving 2 or 3 times the actual dosage of medicines. And a lot of times kids will come in the emergency department either altered or sedated or sleepy. And it's not so much the cold or cough or the cold that's causing this, but maybe it's over-medicating the child because they've given 2 or 3 different brands of medicine that actually have the same medicine and they're not looking carefully at the medicine. So what I always tell parents is to talk to the pharmacist, and every pharmacy or every department grocery store has a pharmacist. Talk to them and get educated. So.
You know, the last time I was in the grocery store, I did go on the counters and look at all the medications. And one of the things that came as a surprise to me is we try to simplify things by putting so many ingredients in one bottle. You know, just take 1 teaspoon of this and it'll cure your cold, by your headache, your fever, your sniffles, and your cough, all 4 together. So now in this particular scenario, when I'm watching it, I was like, oh my gosh, there's that one bottle that cures all 4, and now she's using another thing for the headache and another thing for the future fevers. So what you're doing is you're doubling up on all these doses. So this is really important for you to look at the active ingredients on the drug facts to make sure you're not doubling up on the active ingredients.
Yeah, and I think it adds to the confusion that the use of multiple medications, putting a lot of medications into one source and expecting it to take care of the entire problem is getting worse. Yeah, and it not only confuses the parents, but it also forces them to feel like they need to do something right away. The other thing that concerns me that I see as a pediatrician in an office is that there's also what I call drug labeling confusion, which comes up, in which brand names that are known for one therapeutic or one level of care are now manufacturing medications that are multi-medications in one bottle under that brand name, and the parents don't know they're getting 2 or 3 medications. They think they're still getting the single thing.
What did you think of the storage of those medicines?
Going back to our previous scenarios, I think it's imperative to keep all medicines out of reach of child. And that becomes different for different age groups. Certainly a toddler, you need to have it out of their reach from the floor to lower cabinets, but a child that we just saw in the video certainly can get up on the counter and take those medicines. And now since mom has reinforced the fact that it's okay to take 2, 3, 4 medicines, what's to say that that child coming home from school or where mom's upstairs feels a little cold, won't go and take unknown amount of those medicines and not measure it correctly and overdose. So it's imperative to have those medicines somewhere where an adult can get to. And if signs of overdose are there and you come home and your child's altered or not acting right, you as a parent know what your child is like. Look at your child. If you think something's wrong, seek medical help. And that may start by calling poison control, that may be by calling your pediatrician, or making a trip to the emergency department. You know your child well, and I would act appropriately.
To add to that too, I think it's important before you start mixing medication to actually talk to either the pharmacist or the doctor beforehand. You know, in this case, she's giving all 3 medications. There may be drug-drug interactions that you're not aware of. that can happen too.
And other medicines she's taking. Yeah.
Right.
Absolutely.
Well, and does she need to treat all those things?
Well, the reason you have such a reaction is that you want to return to normal activity. So school-age child, parents want their kids in school. They don't want them missing the homework and all that. So what they're doing is they're looking for the shortcut to getting well to get back to school. But the problem is that that child may still, if it is indeed a cold, the first day you wake up not feeling well, that child is probably going to give that cold away for another couple of days before they're well. So just getting somebody symptom-free doesn't mean they're really well or that they're safe to go back to a community center or a classroom or a babysitter's things. So in a sense, we're helping spread disease by trying to be everything at one time. So that concerns me too.
One thing I want to add to that is anytime you take a medication, make sure your child is well hydrated. Don't just give them medications, make sure that they're well hydrated, lots of fluids. And if you're going to be taking ibuprofen, make sure that they have something in their stomach, they're eating. Because when kids are sick, they don't feel like eating, and you just keep giving them medications. There are side effects to every medications you're given.
Yeah, I think you bring up a nice point. When children are sick, there are things that they behave like which are part of illness, which is you lose your appetite.
Correct.
You don't play like you normally do, and fever. You do get fever. So one shouldn't be surprised if they say my child is has picked up a bad cold or something, and then say, oh, by the way, he also doesn't want to eat as much. And we have to tell parents that's what illness is. Illness is a change in your rhythm and your body, and you observe those things. And of course, you make judgments as to whether they're moderate or mild or severe. Absolutely.
And then the other thing is, when you go to the store and buy medications, there's definitely some things you need to watch out for. It's the rule of 3. You check the medications 3 times. So the first time you buy a medication, look at the box. Make sure it's not tampered with. There's no cuts. It's not torn or anything like that. Once you get the box home, check the bottle itself. Make sure that that tamper-resistant seal is still on. And then once you open it up, make sure you smell it. It doesn't have an odor to it. The tablets are still whole. So always check your medications 3 times before you give it, making sure what the bottle says is exactly the same as what the box says too. And there's no medication error there.
Right, that goes back to what you were saying with your son getting the medicine at the same pharmacy because at the same name, and that's a common error that can happen because again, it's human error that can happen. So it goes back to being vigilant about you and your child. I think that's very important.
Okay, closing thoughts. What one big point do you want to stress?
Well, I work in the emergency department. Of course, for me, is prevention and making sure you have poison control number handy on the refrigerator or on the phone. Know what medicines are in your house, not only for your child, but family members who come and visit or live there. Make sure they're locked away in a lockbox or somewhere where they can't get to them at different stages of growing up. And know your child well, and don't be afraid to call or seek medical attention.
From a pharmacist standpoint, make sure you read. Read what's on the bottle. If you can't read, you don't understand what it's all about, talk to your pharmacist at the pharmacy. Try to go to the same pharmacy and build up that rapport with the pharmacist so they can keep track of what you're taking and what your child's taking. The second thing is don't keep medications forever. Every single medication has an expiration date. Look at the expiration date and throw it out. When it expires, don't keep it around. I find too many people, come in with a big brown bag of medications they had for the last 10 years. Medications do wear off.
Final thoughts for Dr. Cerruti?
Yeah, I think the point I would make is that you should look at medications for what they are. They're specific chemical compounds, drugs that have a specific reason for existing. They have an activity which is specific, and they carry risks as much as they carry benefits, so that when you think you want to use an antibiotic or medication that's not an antibiotic, you want to make sure that you have good clinical criteria for using it, because there's a risk to taking a medication you don't need to take.
Thank you, Dr. Halimi. Thank you, Dr. Cerruti. Thank you, Dr. Dennen. Remember, children are not just small adults. Their needs and their capacities are different from grown-ups. Here are a few helpful things for parents to keep in mind, whatever your child's age. Store all medicines safely and securely. Leave medicines in their original packaging. Always use child-resistant caps. Call poison control immediately. Never tell children that medication is candy. Avoid unnecessary medications. To be safe, lock up any narcotics or other medications that might appeal to a curious teenager. Talk to your doctor, pharmacist, or nurse to find out what mixes well and what doesn't. In conclusion, make sure that your child is getting the right medicine in the right dosage for the right purpose, and help reduce the chances of your having to rush your child to the emergency department because of an adverse reaction to medication. Thank you for watching. We'll see you next time on Voices in Health.